Hello, everybody, and welcome to this week's episode on Fit as a Fiddle. Our guest today is Deb Flashenberg. She is the founder and director of the Prenatal Yoga Center in New York City. And she's also a labor support doula, a Lamaze childbirth educator, and a mother of two. And Deb also has her own podcast as well and is going to talk to us today about all things birth and how prenatal yoga can support birthing individuals in easing labor and prenatally while they're pregnant and postpartum as well. So welcome onto the show today, Deb.
Thank you so much for having me as your guest.
Absolutely. So let's get to know you a little bit more so the audience gets to know your background and what brought you into the space, what brought you into yoga in the first place, and just a
Sure.
little bit about your show and things that you do.
Sure. So I started off actually as a singer dancer, and it was from doing a tour of Carousel that everyone's like, "Oh, you should meet my friend Donna. You should meet my friend Donna." And so, and I finally did. She was doing yoga, so I started to get into yoga, and it started to become where I was thinking, oh, I should go to ballet, but I really want to go to yoga. So then I ended up just kind of acquiescing and going to yoga. So I got into yoga from a movement background, but I was studying a type of yoga that at the time felt really good. It was Bikram and I liked the heat and I liked the stretching. But after doing the training, I realized it was not my thing. You don't have any ability in that type of training to talk to your students and ask them what they want and to really individually work with them. And so after doing the training, I just realized this was not what I should do. So I ended up doing prenatal yoga. Now, this was over 20 years ago, and there was not a lot of yoga at that time. So I found a program and I jumped into that. And then I ended up becoming a doula after one of my students invited me to watch some births. I was in my 20s and none of my friends were having kids. So it's really illegal. She told everyone I was a med student. She dressed me up in scrubs. and I, and I went to some births. I know it's crazy. But just from watching typical hospital births, I realized that all I was doing at the time was just modifying yoga for the pregnant body, but I wasn't doing anything else. I wasn't giving them information about what could happen in the birthing space and how to advocate for themselves and how yoga can help with the birthing process. So I became a doula. And then from there, I became a Lamaze teacher. And then I went down to the farm in Tennessee and I did a midwifery assistant program and a pelvic floor teacher training. And I just kept gathering this information. So with the goal that yoga can help prepare the mind and body for a smoother, more efficient birth. And I really got into understanding the pelvic floor and how the pelvic floor and the bony pelvis can really affect how birth flows. And so that's been a passion for years. So it's something I'm really excited about.
I love that. And you're speaking all my languages there.
Oh, I know.
So Deb, to give you background, I'm come from a dancing background as well. My mom was a dance teacher. And so that's all we did growing up. And my mom did yoga herself for, her whole life, and coming from India, and like, that's just a big part of our culture. And when I say yoga, like not just the yoga asanas aspect of it, but like yoga, the entire way of life and the system of it. So when I did my teacher training for yoga to become a yoga teacher, when I many years ago, it was only after I combined the dance background with the yoga teacher background and then the pelvic floor stuff too, that I really understood how everything comes together. Like just having one of those pieces, it didn't give me, I feel like, the full picture, enough understanding of movement, particularly, movement in general, because everything is connected, but particularly when it comes to the work that we do with birthing individuals, you on the prenatal yoga side and me on the pelvic floor PT side. So I love that you have all of those, backgrounds and coming to being able to see live births. It's such a great, amazing a way of truly understanding, what is a patient going through and what are different patients going through. And then one thing that always fascinates me about it is, even if you go through birth, you're a mother of two, right? So
Mhm.
going through births yourself, you come in with all of this knowledge to be able to tell people and your clients, I'm sure, like tons of great information. But then being a doula and seeing so many different people's types of births from different cultures, different backgrounds, I'm sure that information actually probably informs what you
Oh,
do
that
in your
more
class more.
than absolutely. And I actually always I teach prenatal yoga teacher training, and I actually tell my teacher trainees, you don't have to have given birth to be a really powerful prenatal teacher, because I was teaching prenatal for probably 10 years before I had my son. And I always said that my students were really my teachers, that I would watch how they're moving and I would watch how they work with the poses, because I happen to have a very flexible body. And so that doesn't mean that everyone else does. So I can't go by how I feel and assume that everyone else is going to feel that way. So I was able to try out using different props and different cueing to see what was effective as I built this methodology that I now teach. And it was really the years and years of looking at my students and listening to them that informed me of what resonates best. So absolutely, like the students are the teachers.
Absolutely. I completely agree. I remember I was speaking to a surgeon once about the same kind of conversation. And, the surgeon said, I've never had a knee replacement, but I've done so many knee replacements for so many people with different issues coming in with different backgrounds. And so health like that's what informs my practice and being able to deliver the best care is that there's so many people in this world who have like kind of like a similar need, but then they come in with all of the different, the things that make the patient who they are and why we need to customize a treatment plan when you're speaking medical terms, or customize and curate a yoga class and like use your judgment and not just, if there's no cookie cutter approach to it, right? um
Absolutely.
so I love everything about that. So tell me a little bit about, in terms of, when it comes to prenatal yoga and how you work with your clients and how you work with your students in class. What do you feel like are some of the most effective strategies? It could be like anything, whether it's verbal, cueing, or touching, or what do you feel like is the most effective in helping the pregnant or birthing individual understand and really get to know their body more, that might be maybe different from a non-pregnant person? What do you feel like is the most helpful?
Well, I do think when they start to have a regular practice, checking in with how they feel that day, because the poses are more or less the same. We're going to do down dog, we're going to do cat cow, we're going to do the different warrior poses, but they're different every single time they come on the mat because their baby is growing and their body is changing. So it's such a nice reflection being on the mat to really ground and be like, how do I feel today? How does this pose feel? How might I want to adjust this pose? Or maybe they're noticing it's harder, which I don't back away from safe sensation, because I think it's a really good tool to start to learn coping skills. So maybe they're coming into Utkatasana and it felt much more challenging than it did the time before. Great. I'm not going to tell them they can obviously not do it, but I'll say, like, explore that. What does that feel like now? How do you want to work with that? Do you feel like your breath is as supportive as it was last week? Or do you feel like this time you need to do breath and movement? So I think compared to the non-pregnant body, there's more evidence of change. Like the non-pregnant body, I'm like, I'm a little tighter. But the pregnant body can think, wow, from this week to 2 weeks ago, my baby had a growth spurt, or the baby's dropped, or maybe their spine feels a little different because as baby gets bigger, we know the spine changes. So I think it's just more of a constant change that's more apparent than the non-pregnant body.
I see. And I'm sure bringing awareness to those things, explaining how that all is normal and part of the process is
Mhm.
can be so helpful for students to just understand like this, like, and one thing that I always say with my patients is I always compare like a pregnant person to a child that's growing and has like growing pains. And so it's like, you're kind of catching up to that. And you might not, it just feels different. Like you 1 week to the next, 1 month to the next, your body is just going to feel different because your bones are, shifting and changing.
Yeah.
Your ligaments are shifting and changing.
And your center of gravity and things shift. Yeah. As the spine changes, we know we sometimes get that more forward head, and then we get more kyphosis. So yeah, everything's changing. The way the diaphragm works, the way the pelvic floor works, it's all shifting.
Exactly. And I'm sure that people who, have had, like you said, a consistent practice, doing yoga poses and doing the similar kinds of things, they might then enter their pregnancy and maybe getting closer to their third trimester. And then they're really shifting and their body looks and feels so much more different. They're going to feel each of those classes are doing something different for them. And maybe, a particular asana that feels a certain type of way and helps them in whatever way that they imagined before. It's just different. I mean, I don't want to assign better or worse as like a meaning to it, but it's just going to feel different. And I'm sure that you hear that a lot, right?
I do. Absolutely. Yeah. Actually, just last week, I had a student who started with us at, I think, 11 or 12 weeks. And then last week she was a little past 40. So she passed her due date, and again, we do a lot of the same poses. And what she was saying is like, wow, now down dog is a very different experience than it was when she first walked in the room. She's like, this is so much harder, but it's her perception and where her body is that makes it so much harder.
Exactly. I love that. So what do you feel like some of, like, I guess the most challenging poses that you find for people to get into when they're further along in their pregnancies? What do you feel like is, I don't know,
The more
like people
challenging.
feel, yeah, the ones that maybe, I don't know if challenging in the sense that maybe you might even avoid going into those during pregnancy,
Well,
during the
if
third
it's
trimester? Yeah.
there's nothing that I keep it all pretty much level playing fields.
Mhm.
Um, and we use a way that we use our blocks that think of extensions of our arms. So I keep it pretty well flowing. So I don't separate it first, second, third, except for Shavasana. At the end of class, I don't want my second trimester folks on their back. I'm trying to encourage more ideal fetal positions, so they're on their side. But there's nothing that necessarily is harder. It's just they may feel it's harder. But I actually like to include poses that do add physical sensation. So even the non-pregnant body might feel that. So I came up with this thing years ago. I call it the mock contraction. And it's through my lens of challenge. So it's a wall squat because I find wall squats very challenging. Now I have some students that think it's easy. But a 60-second wall squat, because your average contraction is 60 seconds. So it's more about the physical and mental challenge, because when we can work with something that is 60 seconds and it's a challenge, we can relate that to birth. And we can start talking about our coping skills. We can start talking about what they gravitate towards. So it's not that any pose that I'm teaching in a prenatal class is like an advanced yoga pose, but we do want challenges so that people can feel when they hit that crisis of confidence of like, wow, this is really uncomfortable. How do they get through? Because as I often say, especially with like the mock contraction, no matter what you plan on doing in your labor, whether it's medicated or unmedicated, you're going to have some contractions that you can't get out of, or like your baby's crying and you can't just run away. So how can we build the toolkit to get ourselves through that really muddy moment? And so that's where I think about challenging. So yeah, we're not doing like crazy arm balances or really advanced poses, but it can feel challenging in other ways.
Yeah. Deb, I really, really appreciate that you're bringing in like the whole psychosocial aspect of this, like that comes with parenthood. And birth is really a marathon, right? Like the process
Yes.
of everything. And so obviously at some point in history, people were, especially women were told bed rest during pregnancy or don't really move much during pregnancy. And that obviously has been debunked completely. And all of the research and ACOG and every major medical institution is now hoping that, of course, unless there are certain medical conditions and certain factors, are encouraging the low risk patient or low risk parent who's going into labor to have been moving during their pregnancy. And the
Yes.
recommendation is to get in moderate exercise several times a week, 30 minutes, a couple times a week, almost every day actually is what the recommendation is. And so, and the reason for that is that just, there's like this kind of misnomer that if you stress your body, that's going to stress the baby. But if you look at, heart health, right? Does anyone ever say that getting your heart rate up is bad for you? It's like the opposite. You need to get your heart rate up.
Right.
You need to strengthen. You need to run. You need to get cardio. You need to get into a certain level of pumping your heart, a certain number of beats a minute in order for you to maintain good health for your entire body, all of your systems, but especially your cardiovascular system directly. And so that's why it's so important to stress the body and healthy, relatively symptom free. And, I'm sure you talk to your patients or your clients about like sensations that they feel and, what are you experiencing? Is this a stretch? Like, is this feeling like it's painful? Like you can work through that and understand that, right? And move through those things. But it's just so important to make sure that you are moving appropriately. And when I say stress the body in air quotes, it's in ways that are healthy for you so that you can tolerate the very actually stressful, often birth, right, of your child. And so you have to translate that. And then the part that you added here, which is I absolutely love, is the physical stress and the mental stress go hand in hand. You can't really isolate them, right? And so I love that you add this mock contraction 60-second bit, because that's so great, because you get to really understand, like, these contractions are temporary. I'm sure it also gives us like positive feedback loop of there's going to be an end to this, and this is preparing you. Like the pattern is kind of the same, right? Do your your clients comment on anything like after delivering?
Actually I've had a few that have come back and said they thought about that as labor started. And then what was really interesting about the mock contraction, one of my students noticed this, is there's a study years ago about prenatal yoga. And one of the things they said was that we raise our threshold of reaction. So one time we do the mock contraction, that's what we do a couple times. So the first time they might be like, oh my God, what is this craziness? And then they're used to it. And then we raise that threshold. So the second time they have the coping skill and they're not quite as overwhelmed. And I think that's a lot like labor. And I did have a student come back and she was saying, with each contraction, she reminded herself, okay, I did that one, I can do the next. That one, I can do the next. And she's felt like she just kept kind of walking, what'd she say? Like she was climbing up a ladder. And I thought that was really interesting. I
love that too. Good visual. And that's really what it is. That's a marathon. It's a race. You have to keep kind of going and going and going, and
one foot after the other.
Yeah, the endurance and the understanding that it's gonna stop eventually. It's really just like it's like it's anything. It's like a workout. It's like taking an exam, right? It's like
this too shall pass, over and over in our head. This too shall pass.
Exactly. Anything difficult, right? There's always going to be an end to it. And so I love that you're tying that in together. So let's transition a little bit into like the birth room itself, because you're a doula and you've attended so many births and helped so many individuals. Can you tell us a little bit about how you use your information as a prenatal yoga teacher, understanding movement and how important that is in that labor and delivery room or home birth or birthing center?
Well, I'm not taking births right now. I've taken a little bit of a break from that just because of my kids and schedule, but I was a doula for over 10 years. So I've been to a birth or two. So the thing that I started to really incorporate towards the end of taking clients was I started to get more and more into spinning babies. Currently I'm doing their Spinning Babies Parent Educator program. And what I started to try to bring more into the births was really looking at where is that baby? What positions that baby in? How is the pattern of labor showing up? So is it a functional birth or efficient birth? That means things are just kind of flowing along, or have we hit a stall? And it's totally normal for, labor to have its ups and downs. But what I was able to start to understand from spinning babies and from the prenatal yoga is what can we use from spinning babies and the yoga poses to help the person in labor guide the baby down. And as you totally understand with the pelvis, how can we find some release in the pelvis? So I'm going to totally speak your language, but of some of the pelvic floor. So maybe baby's coming into more the mid pelvis, where we know the pelvic floor starts around those ischial spines, and maybe baby stalled. So how can we use some of the yoga poses that we've learned to help make a little more space for baby? So I like taking the shapes that we do in class and then start to help baby navigate. Because what I often would see if someone had, if someone was stalling out, the first thing they may say, let's give more Pitocin, or let's start Pitocin. So they're adding power to the contraction. But if baby's malpositioned and the chin is away from the chest, and now the forehead's trying to push open instead of the back of the head, all that power of the uterus working to get that, and all that that contraction may not make much of a difference. So can we start to work with the body and work with the baby to readjust things? So it's not just the power of the contraction, it's the contraction helping baby, like a little button through a buttonhole, find its way through the pelvis. So that gets me really excited, knowing that we don't have to just rely on keep hitting her, but fine, get the power of the contraction going, but where is baby and what can we do to be proactive? And I like to do that even before getting into labor. I like to make sure things, and again, speaking probably your language here, what's happening in the pelvic floor, what's happening in the bony pelvis, are we well balanced so that when labor starts, we don't have these obstructions? So that gets me excited about not relying on just the pharmaceuticals, or for someone saying, oh, baby's too big. Is baby too big, or is it baby's position that makes that head circumference bigger?
Yeah. What are some of like the worst things to do in that moment? And like when you're really trying to progress labor from a positional perspective?
I guess staying still. I think movement, like what's the saying? Like motion is lotion. So I guess just stillness, I think, would be the worst. That we want to try to, it doesn't matter if they have an epidural or not. We want to try to move the body. So a lot of hospitals nowadays have peanut balls, or the doula may have a peanut ball. So looking at what different shapes we can make. So yeah, I guess just total stillness would be probably the worst.
Yeah. And what do you say to, I mean, I know you just said epidural or not, but what do you say to the person who's coming in, like, I'm not able to do as much because of the epidural? How do you navigate that conversation?
Well, they still can do a lot. I mean, are they going to be as active as someone without? Not quite, because, we can't get them walking. We can't necessarily get them on their feet, but you can still, with the help of your birth team, we can still move them quite a bit. So using the peanut ball in different directions can still open, depending on where baby is, open the inlet, open the mid pelvis, open the outlet. So I just think we need the knowledge of the birth team there to support. So I'm all for people having the birth they want. I'm never going to tell somebody a gold standard. The gold standard is that someone felt heard and respected, and that they came out not traumatized. I mean, you can have someone that has what might look like a perfect birth, but felt really badly about something during it, maybe how they were spoken to or pressured into something. So epidural or not epidural, I think just finding a team that supports you and will physically help move you would be really great.
I love that. I love it. Well, this has been amazing, Deb. Are there anything else, any other points that you want to add, whether it's from the prenatal side of things, or, when it comes to like actually having a movement practice, or when it comes to applying that into the birth room? Do you have anything else you want to add to our
Yeah,
to
I'd
our
say
audience? Yeah.
absolutely. So I would say when you're looking at prenatal yoga, make sure you're working with someone that is certified in prenatal and really has a strong background, because we can worsen things in yoga if we don't know what we're doing. We can add more tension. That's something that drives me crazy when I'll have a student be like, "Oh, I've been just doing my Kegels. My doctor said to do my Kegels." I'm like, "But do you need to be engaging?" So I'd say find whether it's a pelvic floor PT or a yoga teacher that really understands that, and make sure that you're doing a practice that is supportive and understanding what your individual body needs. And then also when you're on the mat, take the time to let yourself be safely uncomfortable. And it's not just stretch. We do a lot of strengthening so that everything's more balanced. Give yourself the opportunity to find that safe discomfort to build your tools. And then when it comes to the birthing part, make sure that you have a team that believes in you and supports you. And that is anyone from your partner to maybe a doula or the care provider that you chosen. So they should be circling the wagons around you, the birthing person, and that you can trust that they really are holding the space for you and will help you advocate for yourself. So that, because when you're in labor, whether you're medicated or unmedicated, you don't need to be thinking of some of those extraneous things. So I think, yeah, have a good team and get on the mat. And I'm going to again shout out for what you do. Pelvic floor PTs, I think, are invaluable when it comes to a more functional birth, because we want everything to be supple, not overly engaged.
Love it. And absolutely right back at you. I think, yoga has been crucial for so many people. I'm so happy that it's, like you said in the beginning, 20 years ago, there wasn't a lot out there. And now there's so much more information and so much more research. And so more people are aware. Even I've noticed over the last several years, when I kind of say certain poses that are, I think, probably more popular in culture, like child's pose or downward dog, more people are like, oh, they go straight into it and they know what that means, which is awesome.
Yeah.
But I think the work that you guys do is great. And I highly encourage everyone to reach out and also listen to your podcast. So tell us a bit about that.
So I've had my podcast for, I think, 7 years. I don't actually remember. I know we have over three. I know it's crazy. It's called Yoga Birth Babies. We have over 300 episodes, and I've had the incredible honor of speaking with some of the world's leaders in pregnancy and birth, breastfeeding, and parenting. And it started because I'm a bit of a geek, that I was writing blogs for years, because I've been doing this for 20 years. So blogs have been, we blogs were a thing before podcasts. And I loved research and I loved learning. And then when someone mentioned podcast, I thought, wow, this is my opportunity to find people that are really entrenched in this work and have a one-on-one conversation and pick their brains and learn. So it has been so much fun and educational for myself and the community. So Yoga Birth Babies.
Love it. And I'll put that in our show links so everyone can go right to it. And where do people find you on social media too, Deb?
Prenatal Yoga Center.
Amazing. Perfect. Easy. Well, thank you so much for your time. And thank you for chatting with our audience today. And hopefully we'll have you on a show another time as well to talk more.
Thanks so much.